Hi, I'm Dr. Tenesha Ward with Infinity Wellness Center, and May is Lyme Disease Awareness Month. And I've mentioned a couple times now, I've hesitated to really dive into Lyme disease with the other, infection that we're dealing with here, the pandemic of COVID-19, but I think it's worth diving into. A lot of people call Lyme disease the great mimicker because it mimics so many other infections or ailments or diseases. And when I first started into practice, my intention wasn't to see a lot of Lyme disease patients. My history is I had Lyme disease at 15 years old and overcame it with a very similar minded doctor that found it, but it's missed a lot. And chiropractors are often sometimes the first one to see these Lyme disease patients because a lot of the symptoms are headaches, achy joints, fatigue, overwhelming fatigue, could be numbness, tingling, sometimes brain fog, forgetfulness, a lot of flu-like symptoms. Sometimes we see fever, sometimes we don't. We now know only about 30% of the people have the typical bullseye rash. It was thought that if you didn't have the bullseye rash, it wasn't Lyme disease, but that's not true. And more people are denying that Lyme disease is here in Central Texas, and it absolutely is. So be careful out there hiking and biking and take prevention. I'll do another video on that. But if you're bit, you could have symptoms immediately. And some people don't even know they're bit. They can be bit in the backs of the neck, sometimes in the armpit or the groin, places where it's not obvious to see the tick, and sometimes they're so small. But some of the first symptoms are often flu-like, achy joints, fever, fatigue, and then it can kind of morph into more neurological issues, tingling, numbness. I've had people have forgetfulness and brain fog. A lot of fibromyalgia cases are actually Lyme disease. A lot of MS cases, people thought they'd have MS, do the MRI scan, they don't have MS, it's actually Lyme. So again, they call it the great mimicker. When I first went into practice, all these fibromyalgia patients, a very common patient to come into our clinic, or chronic fatigue patient, very common, especially chiropractors all over, right? We see fibromyalgia patients all the time because they hurt all over. And I don't know how to better say it than my spidey senses started going off. Like, yes, we know fibromyalgia is a group of symptoms. We don't know a cause. We don't know a cure. We don't know anything about it. And I don't believe that symptoms just appear. At my core value in practice, I believe there's always a cause, an imbalance. The body is meant to be in balance. So there's something, either an infection blocking or your deficiency, right? So if we take away what's too much or in excess, or we give what's deficient, our body can balance. So I don't really buy we don't know why you have all these symptoms and pain. There's no reason. And then just hearing everybody's stories, they can really name exactly when the symptoms started. They can very much tell you what the first couple symptoms were. Again, my spidey senses are like, this sounds like Lyme disease. So I started testing so many of my chronic fatigue, chronic pain, fibro patients, and I would say over 90% had Lyme disease. So again, it's the great mimicker. It mimics other diseases that we put names on it. Autoimmunity even sometimes is Lyme disease. So again, with Lyme disease, May being Lyme Disease Awareness Month, I just wanted to bring a little light and info on some things to look for. And again, very confusing time with COVID-19 and other things going on, but achy joints, fever, headaches, migraines, stiff joints, sometimes bending the joints are really hard, neurological symptoms, so numbness, tingling, legs falling asleep. I've seen it so far as seizure activity. I've also seen Lyme disease cause like dragging a leg or hard time lifting an arm. So very much affects the musculoskeletal and nervous system. So if these things are going on and all you have for what's wrong with you are things like, oh, you have chronic pain, or oh, you have fatigue. Fatigue is a big one, and not the kind of fatigue like, oh, I just stayed up last night watching Netflix. It is like an overwhelming physical, mental, I can't function, lift my head today, fatigue, typically is what we see with Lyme disease. If those things are happening, please contact us or somebody who knows the proper testing. The other problem is not all tests are accurate. Some of them are only 60 to 70% accurate. So you have to have the proper testing for Lyme disease. And I absolutely have seen it, people contract it here in Central Texas. So please be careful out there as we're enjoying this beautiful weather, and just be aware that that these ailments could be something deeper that we can find and correct. Okay, thanks again. Dr. Tenesha Wards with Infinity Wellness Center.